Hello, I'm Dr. Petros Grivas. I'm a medical oncologist and professor at the Fred Hutchinson Cancer Center, University of Washington in Seattle. We're very excited about our investigator-initiated clinical trial with dose-dense MVAC 4 cycles with growth factor every 2 weeks with 3 doses of Pembrolizumab concurrently in patients who were eligible for cisplatin and were planned to undergo radical cystectomy and lymph node dissection with predominant or pure non-conventional urothelial histology. Those patients, as we all know, are not well represented in clinical trials, and we try to do a trial dedicated for those patients, as I mentioned, with predominant or pure non-conventional urothelial histology, what we call histology subtypes or with divergent histology differentiation. These patients tolerated the combination of dose-dense MVAC plus Pembrolizumab very well. Toxicity was as expected with dose-dense MVAC alone, and patients were, most of them were able to complete treatment with all intended cycles. 15 out of 17 patients, 15 out of 17 patients, proceeded with radical cystectomy and lymph node dissection, and as I mentioned, the combination was feasible, as we have seen in other trials like RETAIN-2 or the ORA trial in Europe, combining dose-dense MVAC with checkpoint inhibition. We saw an impressive pathologic complete response rate, YPT0 and 0, 53%, and one more patient had YPTIS and 0 and is doing great 4 years later on follow-up with no recurrence. One additional patient who did not undergo cystectomy had a clinical complete response with consolidation of chemoradiation and is also recurrence-free, doing great over time. Overall, the results were very promising, showing that the combination of dose-dense MVAC plus Pembrolizumab is a promising combination in those patients with histology subtype, non-conventional urothelial bladder cancer, and also shows that dose-dense MVAC appears to be a good partner with checkpoint inhibition. Of course, this was a small trial, single center, only 17 patients, and we're looking forward to expand our experience and hopefully maybe through cooperative groups do a larger trial in this important patient population that is not well represented in clinical trials. I hope you enjoy the paper in European Urology and looking forward to discussing with you further more details about this clinical trial.